It's a relentless frontline fight. The battle against COVID, a virus doctors and nurses call the beast. Each room is a maze of machines and medical equipment.
Gonna give you a suction down your breathing tube here, Jeremy. Might make you cough.
Jeremy Johnson hasn't been able to breathe on his own for 47 days, even though he no longer has COVID.
It's all the side effects from COVID is what he's now dealing with. So he makes baby steps, and then he takes like 3 steps back.
Inserting tubes in patients' airways or intubating comes with uncertainties.
The risks and benefits for some of these procedures is developing other infections. Trying to save someone's life, there's always those risks and benefits. So he's still quite sick. He's still in septic shock.
ICU staff are the closest to the pressure and the risk.
I think we have to really trust in what we do for our personal protective equipment, our PPE. We're fitted with N95 respirators. Most recently, we have reusable ones that help keep the virus out of our bodies. But exposure is always a risk. It's a risk of the job.
The emotional stress is exhausting.
And as we donned what I call the mask of COVID-19, there was this vaguely dehumanizing effect that happened. I could no longer read my colleagues' faces. I could no longer sense their emotion when they were feeling overwhelmed or nervous or needed backup, as we always have been able to read each other. We've gotten very good at reading each other's eyes. We look into them deeply and they tell a story.
It's a story about the breaking point. Royal Columbian Hospital has 16 ICU beds, but averaged 42 patients at a time during COVID at its worst.
May I end up working 20 out of 31 days, that's a lot more than what the average. You typically work between 12 and 14 shifts in a month.
It's a story about the heartache. Until this week, there were no visitors in the ICU, not even during end of life. This experience with one patient and his wife isn't unique.
My picture was a small little face in the corner of the screen, and while she was on the FaceTime call, and she was crying her eyes out and reminding him of their wedding day and their little kids and how she will protect them. And as we took him off life support, and his heart rate slowly started to drop down and his blood pressure started to fade away, and it was me that was holding his hand, and as a family we're just sitting on a square screen, and that's cruel to be a part of that in person, but we were the closest people that could provide that care and that touch at that moment.
A lot of recovery is yet to come.
You'd asked before about what I think the next concerns are. I think it's for how our healthcare system is doing, how the healthcare workers are doing through this, and how they recover. I'm concerned for some of their mental health, and I'm concerned for their burnout.
RCH isn't the only COVID centre in the region, but it's the only one equipped with heart-lung bypass machines for patients who can't breathe at all, not even with a ventilator. The sickest of the sick COVID patients in the region come to this ICU. In the first and second wave, those patients were mostly in their 80s and 90s. In the third wave, the average age is considerably younger.
Poor guy.
He's diabetic too, right? So it's just other things. I feel so bad for him.
Jeremy Johnson is 44. He spent his birthday here alone and heavily sedated. Only last week, his wife and their boys were able to visit for the first time since April 21st.
But it was nice to, let him feel our touch. So, and let him hear my voice next to him instead of being on a FaceTime.
Rika Johnson is actually a nurse at RCH, but on leave.
Code Blue Healthcare Center, ICU, bed 16. Code Blue Healthcare Center, ICU, bed 16.
Because when this happens, it's just too much.
That's not his bed, but still that.
Jeremy is in bed 8.
Hi, Jeremy. It's Serafina from Respiratory. I'm just going to take a listen to your breathing here.
It continues to be a long haul for Jeremy and those who care for him.
It started out as fear because you don't know, and then exhaustion, and then there'd be frustration because it wasn't going away. And then there was also times of like uplift, like the 7 p.m. cheer. That helped. That kept us going.
What also keeps them going is behind every COVID statistic, there's a name and a story. Belle, Puri, CBC News, New Westminster.